Welcome back. Thank you for your company on the AM show. Now, as we started the show, we did tell you that we'd be talking about COVID-19 related matters, and it's on the back of the COVID-19 National Trust Fund intimating that it was in dire need of funding. Our guest this morning, Kwame Bempa Osei, he speaks for the COVID-19 Trust Fund. A very good morning to you.
Good morning, boss. How are you?
It's good to have you, for a conversation like
I'm
this.
also happy to be with you.
Right. Is the COVID-19 National Trust Fund broke? Are you broke?
We are not broke. Mm-hmm. I don't understand where I should place the word broke, but we need a lot more contributions in order to carry on with the mandate that has been placed on us, because you realize that the setting up of the COVID-19 National Trust Fund was mainly to complement the efforts of government in combating the COVID-19 pandemic. And by that, we don't receive government support. Ours is to collect monies from private individuals who are willing to contribute to support the fight of the COVID-19 pandemic. So our contributions are voluntary. And we say that the beggar has no choice. So you appeal to people, you appeal to institutions, you depend on their sympathies and benefactors. So if they bring it, you continue. If it happens that the contributions that you receive, the support that you receive is not forthcoming, then you need to intensify your efforts, fundraising efforts, appealing to the groups and individuals to come to your aid, because what we get is what we use to engage in our activities. So yes, from the onset, we saw the enthusiasm from benevolent organizations coming on their own to our premises. At a certain days, we were receiving more than 10, 13, 16 groups coming to make donations, because that was the period where the cases of COVID-19 were rising. And for that matter, people saw the need to also contribute their quota in helping to combat the pandemic. When time went on, it seems that people have gotten a certain misconception that the disease is no more, right, and it is going. So the conversation is that why do you continue to give money to a disease or a virus that is going away or is no more with us? So that kind of attitude has affected the kind of contributions that we were receiving.
But as you speak of that attitude, just to interject here, don't you feel then that, of course, the novelty of it made a lot of people panic, a lot of people want to jump on board. But with all that has happened and with things getting better, the lockdowns being eased across the world, it was to be expected, wasn't it? So maybe the trust fund, you took your foot off the pedal, assuming that, the contributions will keep coming. And of course, naturally, they dwindled. So maybe some responsibility there.
We didn't keep our foot off the pedal because it was even at that time that we intensified our fundraising activities, where we were appealing to individuals through personal contact, through letters, through one-on-one engagements and so on, so that people will see the need to contribute. But like you said, you are right in a certain way that within the world stage, there seemed to have been a reduction in the numbers of infections and so on. So people felt that the virus was going away. But the case as it is now does not support the fact, because you realize that there has been a surge, second wave of infections almost around the world. Today, in Germany, there is a serious issue about whether the entire nation should be locked down. States are saying that no, we won't agree. There has been several meetings between the chancellor and state governors as to how they should approach the second wave of infections. In the UK, in Belgium, everywhere, and in India and in Pakistan, everywhere in the world, the frightening second wave of coronavirus infections also should give us a worry as a country that
Especially as our case count is also,
looking at the fact that in our case count is also increasing. We came down to less than 400. Now we've risen beyond 1,000 active cases, and that is frightening.
But that feeds exactly into my point. It appears we eased the pressure a bit, and even with regard to the COVID-19 National Trust Fund, because if we really saw that need to continue fighting, to continue getting funding, support, we would have kept up at it. But would you say that it's the same? It obviously isn't the same.
It is the same not because we didn't intensify our fundraising efforts. Because you realize that the first time we had the engagement, I told you that as a private national fund, we needed to form partnerships with other state institutions because we can't do it alone. So from the onset, we engaged the National Commission for Civic Education and said that you are the state institution responsible for sensitization and public education. They came with their budget. We were able to meet them halfway. We gave them 2.5 million cedis to engage in public education. And on Tuesday at our symposium, their deputy director in charge of operations, Mr. Samuel Asare-Kwamwa, gave a testimony about how the support we provided to the National Commission for Civic Education has in a way revitalized their activities and the kind of public education that they've conducted across the length and breadth of this country. Over 43,000 communities that they have visited in the whole of the country. And now they have a surplus of what we provided to them. And they were asking the permission of the board to use that to also fund their media advertisement and public education.
How much exactly did you give? What kind of support did you give?
$2.5 million. They bought pickups.
$2.5 million?
No, sorry, 2.5 million Ghana cedis. They bought about 10 pickups. They bought education crafting materials like specialized computers that they will use to craft their infographics and all those things. And they also use some of the money, like the deputy director said on Tuesday, to resurrect some of their equipment, especially vehicles that has been there since 2009 and they were not functioning.
So the money you gave, the 2.5 million Ghana cedis, went a long way to
support them. This testimony is coming from the National Commission for Civic Education themselves. It is not coming from me. On Tuesday, it is there. The footage is there. Your people were there. I can send it to you, and you can also use it. So the groups that were invited to provide testimony, including the Noguchi research place, where in the initial stages, a lot of the research activities for COVID was being done only in Noguchi until they added KCCR. Now, according to Professor Ampofo, they have about 22 testing centers. And this was as a result of the kind of support that they received in terms of equipment purchase, regions, and others to boost their testing capacity.
So support to the NCC and other organizations. So let's break down the figures. The last time I interacted with you, you did indicate that you had got just about 36 million Ghana cedis. What are the figures now? How much exactly has the COVID-19 National Trust Fund got in total, especially between then and now? And what are the dwindling returns? Tell us about that.
As at 27th of October, the last we updated, we received 57 million. About 57 million Ghana cedis. And by that same time, we've also disbursed about 41 million.
So that leaves you with about 16 million.
Yes, and that 16 million also, some activities are still ongoing that we've not even included in the expenditure. For example, there was the immediate need to determine the impact of the COVID-19 pandemic on households in Ghana. And we were as to how to go about it to determine the impact. So we find out that the Institute of Statistical, Social and Economic Research of University of Ghana has done a lot of work on the socioeconomic impact of ABCD. So we engaged Professor Kote and his people, and they accepted that they will conduct a nationwide research to determine the impact of the coronavirus pandemic on households. They did that, and the outcome suggested that we can assist individual households with certain amount of money to ease them from the impact that they've gotten from the COVID-19 pandemic. So we selected 10,392 individuals to disburse, to give them 500 Ghana cedis each.
10,392.
Yes, 92 individuals, to give them 500 Ghana cedis each. It is not something that will be considered as big, but depending upon their background and the kind of problems that they are going through, we could have done more, and we need to do more. But the resources...
So that figure, 10,392 by
500
would give you 5,196,000.
So that is also going to go away from the 16 million that you mentioned.
So practically you'd be left with about 11 million.
Yes.
Because 5.1 plus million.
And that will not also sit there, because we continue to receive requests for support of projects and activities, all that. And don't forget that as a trust fund, we have a mandate. And the act that establishes the trust fund specifically provides us the framework within which we can operate. And in operating, you do not want to go beyond your mandate. And the two responsibilities that has been placed on the shoulders of the COVID-19 National Trust Fund is to support those who are directly engaged in the combat of COVID-19. And the second one is to also support those who have been affected with or afflicted by the COVID-19 pandemic, especially the vulnerable in the society. That is why when you look at our programs and activities, the food items, the non-cash items that were provided to us from the beginning, which we have quantified to about 8 million Ghana cedis, a lot went to institutions like HelpAge Ghana, like the children's homes. And in our symposium last Tuesday, representatives from these institutions came and provided just testimonies about what these interventions has done to them, because they have a lot of people to reach to, a lot of individuals who are in a state of what I can say despair, that they needed support, and how that support we provided have gone a long way in supporting them and bringing relief. So during the symposium, what you hear is that Oliver Twist asked for more. Oliver Twist.
So a lot of them were now.
So institutions like the support that we gave to the private sector, COVID-19 private sector fund, to complete the National Infectious Disease Center at the Ghanese area in Accra.
That was largely supported by
we gave them about 6 million. We gave them about 6 million Ghana cedis and $1.2 million for them to be able to finish the
all out of that pool of 51.
Yes, out of the 56 that have the 41 that we've disbursed, all that is included. So they are saying that you've helped us a lot. We appreciate what you have done.
So a lot of the appreciation, and of course it stands to reason that when someone does something good for you, you appreciate the gesture. But don't you think it's a little too late, this accountability, the transparency? Because I recall, Her Ladyship, the former Chief Justice, your board chair, actually indicating back then, when people raised some concerns about how the money would be used, what it would be used for, I remember hearing, the rhetoric of every peso would be accounted for and everything would be made very visible to every, Ghanaian. But that hasn't panned out, that hasn't turned out to be the case. Because between my last interaction with you and talking to you now, we've not had any facts and figures, any real information being put out there with regard to, look, this is how much we've been getting, maybe on a monthly basis, because it would be difficult to say every week a common account, but on a monthly basis. That has not happened. And if you put that side by side with, look, in church, your pastor tells you, let's do this project. They take money. You don't see anything. What happens? The next time they come calling, you don't really want to give. I'm not suggesting that is the case, but don't you feel in terms of giving account for what you've got, you've been too slow, lethargic, and that maybe has led to the dwindle in resources?
I want to take on board the suggestion that at least we can do a monthly account to the general public as to what we've done and how much we spend and so on. That is a very good suggestion that we can take on board.
Is that something you're going to take on?
But yes, we will take that on board because there is nothing to hide. Everything that we are saying, we have records to back it, and her leadership, the Chief Justice and the former Chief Justice and the Chairperson is right that every PESWA will be accounted for, and it is being accounted for. But maybe as to the intervals of accountability, the lack may be something that we may have to take a relook at. But we've also been doing, because if you recall, I released a press statement indicating what we have done, and I sent it to all the media houses. We were expecting
How long ago was
there
this?
will be a follow-up.
How long ago was this?
Oh yes, it's been about 2 months back. 2 months back, around I think it was around September, and then I'll check the exact date. And we've also been engaging individuals on platforms like this, engaging the general public on platforms like this. And the symposium was an event that sent to a lot of the people, the general public, our stakeholders, our donors, those that we've supported, our partners, and so on, to appreciate what we have done. That appreciation is what I am also giving. And it is not coming from me. But the point I was trying to hammer was that because of these disbursements, you agree that our resources will surely dwindle. Right. But the demand is also coming. And mind you, if you compare what we have taken, 57 million, to the lot that has gone into the combat of COVID-19, and I would like to reiterate the point that we don't receive any support from central government in terms of financial disbursement or budgetary allocations.
You rather are disbursing to government agencies.
Yes, through individual contributions. So when you are going to beg, you have a limit as to what you go, because you are depending on the individual or the corporate organization or the group. Give me something to do more. And if the something is not coming, it limits you to a certain extent. And I think that there are certain factors that has contributed to this. And one of it is the earlier point that I made about that lack of appreciation that the disease is going. So why should I contribute to fighting a disease that is going? But we need to appreciate the fact that the disease is still with us. Coronavirus is not gone. Even if Pfizer, Moderna, and Biotech, and the Oxford University, and in India, I'm also hearing that they are saying they have gotten a vaccine. Even when the vaccine comes, we will still be living with coronavirus, because we have polio vaccine, but people still suffer from polio.
And even the vaccine is not full.
Yes, and the
none of those I've seen goes as far as 100%.
Proof, because they are still testing. Yourself. Some are saying they've gotten 90% success outcome. How potent it's going to be is yet to be determined when the mass production starts in the first quarter of 2021, next year. So we need to appreciate the fact that it is not the responsibility of COVID-19 National Trust Fund alone, neither is it the responsibility of Ghana's Health Service alone, nor the responsibility of central government alone, but a collective responsibility of all stakeholders. The media, you need to do your part, and
like
you are doing it. You are doing it like you are doing. You invited me when I didn't even know that you were going to invite me. And that is part of your responsibility of educating the public, providing platforms of this nature for institutions to also drum home what they are doing. So that collective responsibility, when it is appreciated and when it is taken on board, and the fact that the numbers are increasing and rising, should also give that kind of reawakening spirit, a spirit within us not to relent in our efforts in the combat of the COVID-19 pandemic, because the consequence may be very disastrous. And that is the way that I think we need to look at it in a more holistic manner than to leave it to, let's say, COVID-19 National Trust Fund or state institutions. From the a presentation given by the Presidential Advisor on Health, Dr. Anthony Siansare, at the symposium, even immediately after the last broadcast, the 19th broadcast of the president,
right,
and his point that people have stopped wearing the masks. The
dropped from about 46% to 5%.
Yes,
that's
the cases that
horribly low
they were getting has gone down. So it tells you that if all should take the responsibility of doing their part, we will go a long way to be successful in our fight against the coronavirus pandemic.
It is, as we do this.
You have been watching your platforms, the JoyNews, the Adom, and so on. And when you go outside and talk to people, you can bear testimony to the kind of attitude that people have against coronavirus. It was when the police and the security agencies were chasing people with canes that they find it prudent to wear their masks. Now, no policeman is chasing anybody. So when you go to our public transport, the trotros and everywhere, people are not using the face masks. And the medical experts who were there, Dr. Nsiasare, Dr. Lee Samba, Professor Ampofo, Dr. Tanko, and everybody bear testimony to the fact that across the world, the wearing of the mask has been identified as one of the preventive measures against the spread of COVID-19. So we need to put our efforts together to continue with the education, to continue with the support. And we can only do this because the COVID-19 National Trust Fund itself should take on our own initiative, public education campaigns. But when it comes to that, we don't have enough personnel. We are not an institution that should come here and lament.
Right.
But we don't have, because from the onset, everybody thought that COVID was going to stay with us for a short period of time. Now, in March 29th, and April 8th that the board was sworn in. How many months now? We are still have to confront COVID-19.
So bottom line, we're all involved, like the words in
yes,
that song. We're all involved in building our motherland Ghana.
Yes.
And we can't build Ghana if COVID-19 keeps ravaging the populace. Now, to wrap up, you did indicate that, the MTN Foundation had made a donation of items worth about 5 million Ghana cedis, right?
Yeah.
And you also indicated, to me, right before we started this conversation, that the last contribution you got was from an individual that was at the tail end of August.
No, so we got it somewhere in October. But from the ending of August through September up to October and the last part of October, where we received that donation, nothing has come.
Good. So as we wrap up, I want you to look ordinary Ghanaians, organizations, look Ghanaians in the eye and make a pitch to them about why, apart from all that you've said, why they should come on board and make contributions. Nothing is too small.
And like I said, we have a mandate to discharge. And the mandate can only be discharged with enough resources. What we have done now, the appreciation based on the testimonies that were given by institutions and individuals, bear testimony to the fact that yes, we've done so much. And what we have done has also impacted in the combat of the COVID-19. We need to do more, and we can only do more when we get enough resources to be able to discharge the mandate. And since we don't receive any support from government, we rely on the benefactors of organizations, corporate individuals, and so on. We need enough PPEs to go around because the medical facilities, the big ones and the small ones, the frontline workers, the appeal is that yes, you've done so much, but some of them are disposables. You wear and you have to throw it away, whether it's a cover-up, whether it's a goggle. A lot of the PPE that we give to medical facilities and frontline workers are disposable. So you need to get them in multiple quantities to be able to discharge their work without any problems. So we are still, although we appreciate what has been done to us, because we receive donations from over 600 contributors. Wow. From corporate bodies, individuals, groups, associations, churches, NGOs, and so on. About 600. And we've been publishing the names in the dailies with the contributions that they have given. So we are saying that come to the aid of the COVID-19 National Trust Fund. You can walk to any CBG bank or GCB, formerly Ghana Commercial Bank.
I was just about to
just
ask
say that,
mechanisms.
yes, just say that you are coming to contribute to the COVID-19 National Trust Fund, and they will assist you with the account numbers for you to do your donation. And if you have the Kitwebi Ensha to also present, it is star 100, star 887 star 100 hash.
Star 887 star 100
hash.
hash.
That is the code that you can use to make your donation. The Kitwebi Ensha and MTN, Airtel, Tigo, and Vodafone. Star 887 star 100 hash, and we will appreciate everything. And we like to also commend the individuals and organizations that have made contributions to us so far.
Right. And
Oliver Twist asks for more. If they still have some to give, we appreciate their contributions so that we'll be able to reach every corner of the country in terms of our activities.
Mr. Bempos, I would love to thank you so much. And we just want you to know that we're firmly behind you, supporting the cause to rid our nation and the entire world, of COVID-19. Kwame Bempos is Communications Director for the COVID-19 Trust Fund. And he has been, discoursing with us. Thank you so much for coming. We're taking a break, and when we come back, a lot to expect from women in power and politics. The Member of Parliament for Wejak Bawe is actually going to be having a discourse with us. Do stay tuned for that.